Welcome back to the Big Ideas Theater. I'm Ed Highland here at the AARC Congress, and I'm joined now by Michael Hess. Michael, thanks so much for coming by.
Thank you for having me.
I was saying before we started, your title for your topic is one of the best ones here. Searching for Florence, respiratory care needs a Nightingale. What do you mean by that?
Well, many professions, including nursing, they have a particular iconic person to look for. Nursing has Florence Nightingale, medicine has Hippocrates or that Z-Dog MD fellow, and I don't think we really have that as a profession. We don't have an aspirational icon to reach toward or to explain to people what we do.
Now, is there concern about if you're adopting a Nightingale, so to speak, that will kind of get lost? Our personality, our what we do will get kind of lost in that identity?
I really don't think so. Obviously, nursing has done a very good job into branching out into a variety of different areas: public health nursing, school nursing, everything. I see no reason a creative and innovative group of folks like respiratory therapists would experience any kind of limitation like that.
What's the process of figuring out who our Nightingale is?
Well, that is the $64,000 question. It's very difficult. We have to kind of distill what it is to be a respiratory therapist into one sort of figurehead. And it's very difficult. We have respiratory therapists working in a variety of different settings and different roles, and we're sort of working backwards. Nursing kind of grew from this one icon into a lot of other fields, and now we have to distill what is the essence of respiratory therapy. Is it creativity? Is it professionalism? Is it innovation, vision? What is that? And then try to assign those characteristics to a person, and that is not an easy task.
So in some respects, and throwing out a contrary point here, you're almost more of a chameleon than a Nightingale because you have to change depending on the situation, who you're working with sometimes, your institution, and with regulations. I mean, it's a constantly evolving character, if you will.
Well, and that's a great point, and it may end up that we are not able to define that. Maybe we just have a respiratory therapy person, an archetype, that there's room for that also. I do think it helps to have somebody to point to, when we go out to high schools or colleges and try to do recruitment, to say, if this is the kind of thing you want to be, you can be like so-and-so. I think that has helped other professions, and I do think it can help ours, but by no means is that guaranteed, and it may end up being something like a chameleon. It works pretty well for the car insurance industry.
The folks in one of the booths here, Geico, I believe, would be very happy with that. One thing that's also interesting, I think, is talking about advocacy. And there is so much, you were talking about how we need someone we can point to as kind of our reference, our Nightingale out there. And everyone, hopefully, is getting involved with advocacy. You need to make sure that your word is heard. And in that respect, you have to establish an identity. You have to be out in the forefront, maybe even going outside your own skin, so to speak, to stand on the stage and shout from the rooftops, hey, we need these regulations, or we need this change, or we need this funding.
That's absolutely right. We need to be loud about who we are. We need to tell everybody, as you say, shout it from the mountaintops. Unfortunately, we have, I often describe us as the best kept secret in healthcare, which is a great catchphrase, but it doesn't really help us when it comes to speaking to legislators, speaking to policymakers, making our case with administration sometimes. Nobody knows what we do. And whatever figurehead, whatever path we choose to follow, we need to change that.
And this is what your session's going to be about coming up on Friday, I believe.
Yes, sir.
A little more? Can you give us a couple more nuggets? Because we got a second here we want to talk about.
Well, we do cover a lot of these issues, actually. We talk about why we need that. We talk a little bit about the history of Florence Nightingale and the impact she had on nursing and on healthcare in general. We have a couple of candidates. I did a little informal secret polling earlier this year in the community to see if we had any candidates. So we'll find out if one of them made the cut or if we need to keep looking.
Could be Z-Dog, you never know. All right, Michael, thank you so much for coming by and sharing with us. We'll look forward to your session on Friday.
Thank you very much. I appreciate the opportunity.
And this is the Big Ideas Theater at AARC Congress.